All right. Hey, everybody. It's Eric, Peer Support Director, RPH Ally. I am here with a very special guest, Alejandro. He's one of the co-founders of an amazing app called uMore. I came across the uMore app a little over a year ago. I think somebody posted about it on social media, talking about how it was a very different app you can use to improve your mental health and well-being. So I started using it about a year ago, actually reached out to Alejandro. We've had a couple conversations back and forth, and it's such an awesome app, and he's such an awesome guy. I wanted to bring him on our RPH Ally show here so you guys can learn a little bit more about him and his app. So we're going to dive right into his spiel after this reel. All right, that's always fun. Alejandro, thank you so much for joining us. It's an honor to have you on our show.
Thank you very much. That was an incredibly kind introduction. So it's great to be here. Looking forward to it.
Yeah, awesome. So, first thing I think it would be good for our viewers to know is, talk a little bit about your background in mental health and in technology, and why you guys decided to create this app and what makes it different than, all the other mental health apps that are out there.
Yeah, of course. We actually came together during the height of the first wave of the pandemic in 2020. There was a national hackathon being put on in the UK to try and solve for problems brought about by COVID. And we really focused on the element of mental health and loneliness. And what we wanted to do was build a tracker that helped people better understand how they felt while also being able to track that over time. So that's where we started to develop uMore. And we ended up winning that national competition. It gave us all the validation we needed to keep going. So that's exactly what we did. We fundraised and we built out the app. We just launched our version for clinicians that went live about a month ago. Have 3 customers now, which is exciting. And we still have a lot to learn, in how we go about validating this and working with new customers. So really excited to get, the pharmacy perspective from yourself as well a little later today. To answer your second question about, why this app? Well, we really wanted to make sure that what we did was going to basically not only help people better understand themselves, but help their clinician run the way that they do, all of their clinical documentation and all the admin work that comes with part of that job. What we understood was that there was a lot of admin work required that was taking out a lot of the time in the day that could be spent with patients. And we have such long wait lists in the US where we have such a high demand for mental health services, not enough psychiatrists, psychotherapists, and other clinicians to service that. We think that by being able to, offer clinicians the ability to collect data from the app that, our users are using, we're going to be able to streamline quite a few of those processes.
Yeah, that's really neat, because I know when the app first came out, it was just for the user. So it was like, I can use it just for my personal use, but you guys were developing something for the clinician. It sounds like you just came out with that. And my understanding correctly is the user goes on and they're logging, their symptoms along with some other things, throughout the day on a daily basis. And now that information is shared with their provider, which gives their provider much better insight into how that patient is actually doing on the current treatment, much better than only seeing that patient, every month or every 3 months and checking in with them. Here, they actually have the ability to look at their inputs to the app and get a much clearer, bigger picture of how they're doing mentally.
Yeah, exactly. It's, a detailed overview of someone's mental health using this as a remote patient monitoring tool. I should probably describe the 2 sides to it, and how it works from the user perspective. We have the smartphone app, which can be used by anyone who is receiving care. And what we do is we help them measure and monitor mental health in a few different ways. We use ecological momentary assessment. So that's where we can pick up details on their mood, data about what they've been doing in the day, journaling and natural language processing that we're able to take from that. But also things such as, how have they been taking their medication? How often, in what quantities? So that's what we do kind of on the day-to-day. Then we also have psychometrics, which they usually do like weekly or every 2 weeks. So this is where we have like the GAD-7 and the PHQ-9 to be able to understand those more mental health-based outcomes. And we also use some digital phenotyping. So smartphone data, we connect with Apple Health and Google Fit to be able to better understand also some of those other like physical variables of health and how they correlate with mental health as well. And all of that we then, like you said, share with the clinician. We have a dashboard where they can view it all. But also we permit them to connect with these users through telehealth features. So you can connect with them, that is the client using the app and yourself using the dashboard. And from there, we're able to be able to help them with their clinical documentation using this data, automating a lot of those processes, and also taking care of some of the insurance billing processes as well, because a lot of the surveys that they're doing on the app are actually reimbursable under CPT codes.
That's amazing. That's amazing. This all sounds great, and I bet you a lot of our viewers are saying, "Okay, well, what is it?" Are you able to show us like a demo of what some of this actually looks like, so we can get a better grasp of the app and what it is?
Yeah, absolutely. What I'll do is I'll present from my desktop. Earlier, I tried to present from my phone, and unfortunately, it couldn't pick it up. So I won't be able to share the app itself, but I'll show you all the data that comes from it and what it looks like. So let me just hop into that now. Okay. Can you see my screen? I should be on the App Store now.
Yep, it's there.
Great. So yeah, this is a look at the app that the patients use. Just a few screens. As you can see, it's available on Apple, but also on Google. And as you can see, this is where people come in to basically select how it is that they're feeling. This is a snippet from our ecological momentary assessment tool, which we validated psychometrically with research with the University of Glasgow. And when data is inputted, it can be from these emoticons, but also we use emotional tag words. We use, as I mentioned, people can input their experiences from the day. So they're able to say, whether they were socializing, whether they were like speaking with family, what they were doing and how that affected their mood and their mental well-being. We also give them some insights, and we also actually have a self-help section as well, so they can engage with things to help them understand, what makes them feel better. And I'll give you a little snippet of what this data looks like and how it looks like to share with a clinician. This is a export of a dummy client that we did through PDF that shows some of the visualizations. So these are indications from the psychometrics. We're able to show what is the level of stress, anxiety, and depression, as well as what are the main indicators from those surveys, and therefore what are, the most prevalent symptoms that are present. And we also show some analysis on their mood, recently. So we have the most popular mood triggers over the last 7 days. I mentioned that the user can input, what they were doing. So we see here that the gym, being outdoors and going to the shops is correlating quite highly with their positive moods, whereas their negative moods are correlating quite highly with screen time, transport, and family. And in this sense, we try and keep the snapshot really visual. So it's very easy just to scan it in the little time that clinicians have in a day to be able to get this understanding of, the client. But we're also able to show this sort of more compact. So we can show day by day, what were the things that they were doing in those data exports and, potentially import those into EHRs as well. And yeah, the last thing I'll show is just some more statistics. I mentioned, with digital phenotyping, we're able to correlate the steps that they take in a day to their moods. We can also do this, for example, with the medication that they've been taking, the days in which they have taken it versus not taken it, how, what has been the correlation there. And we have tracking features that also can display the patterns over the last 3 months as well. So we can start to spot some of those trends. And the last thing I'll show is what this looks like from the dashboard perspective for the clinician themselves. They receive a dashboard a little like this, and they have a client list where they can interact with all of their clients and get a sense of how they've been doing. So I'll use Sue as an example. If I click on here, I can see her personal information. Of course, this is all just dummy information. I can click through some of those last sessions that I've had with Sue, be able to see the notes that were taken from that session. And this is actually using voice-to-text technology. So I'll give you an example as a continuation of this. I can just click the button and say, Sue has shown progress and she is doing well. And as you can see, in a very quick and punchy way, it allows us to record that information. And I mentioned we also help with insurance billing. So this is an example of super bills that we're generating with Sue. We basically are able to record all of the sessions, all of the telehealth sessions we've had with Sue, us coming in from the dashboard and Sue coming in from the app. And yeah, this is automatically all taken care of because of that data we're able to collect. So it basically all comes together, dashboard and app, to create this combination that is keeping clients engaged, We have actually a really good retention rate, 58% at 30 days, which is about 7 times higher than the industry average. But also a tool which is helpful for clinicians in, being able to save them time, but also dealing with some of these reimbursable elements of the surveys we have in the app to also help with, growing revenues and helping with admin.
Wow, that's impressive. That's impressive. Obviously, a lot of benefit from your guys' technology and creating the app. One of the questions I had when you were showing that dashboard, is there a way for the clinician to be notified if a patient of theirs is, doing really poorly, if they are, severely depressed and they're entering that data into the app? Does the clinician get notified to reach out to that person?
Yeah, so it's something which we have actually within the client app at the moment. If we ever detect that they have a high level of anxiety or depression or stress, as per those clinical thresholds on each of those surveys, what we do is we link them to a list of mental health helplines, which we created, compiling all of the helplines that are available across the world. And to our knowledge, it's actually the most internationally comprehensive mental health helpline database on the internet. And for us, it's very simple to be able to take that and implement it on the clinician side so that they are getting those notifications.
Okay, neat. And just to back up for a second, so everybody viewing this understands, I could be just an individual who wants to have an app just for my own self, and I can go to the App Store and I can download the uMore app and use it for just me. Or at the same time, if my provider is using the uMore platform, that can be a tool that they use for their treatment, right?
Exactly.
Right. So for anybody out there who just wants to go to the App Store, download the app, check it out, use it for yourself. There's a lot of benefit to that. It's really neat, a lot of resources, a lot of features on it. Let me ask you this. Do you know the percentage of users that are using it in partnership with their clinician versus just using it at home themselves?
That's something which we're starting to explore. Like I mentioned, we released the dashboard about a month ago. So we have 3 doctors, on board now, and it's something that we're monitoring. Yeah.
That's right. So it's probably obviously relatively small because it just came out. Okay.
Early days. Yeah.
Yeah. And Alejandro, you have a background in psychology, in research. I don't think you talked about that at all, but I think that's important for the users or for the viewers to know as well. Because if you're going in my opinion, and you're designing technology like this, if you're a clinician or a practitioner, yourself, and you have that training, and then you're going in developing this technology, you're going to come out with a much better product than if you had none of that background at all. So the fact that you do have, significant background in mental health and academic research and psychology, I mean, you're going to have a stellar product, which you guys do. And I'm sure that's one of the reasons for it.
Absolutely. Research is super key, not just, building the app based off of prior research. We actually put together a white paper that talks about all of the research that we took into consideration to design it, which I'm happy to share if, you want to circulate that with the RPH Ally community as well. But also ongoing research to make sure that those novel implementations are also, being looked into. So my background, as you mentioned, is in academic research. I took the jump from that world to the technology world to start to build and start to add, so for these sort of practicalities of implementing research. But we also do a lot of ongoing research with great partners. We have a great partnership with the University of Glasgow, where we do a lot of our psychometric research. We also have a study ongoing with the University of Cambridge now, looking at the perceptions of the usage of the app from its users, and also about to launch a new study this April, looking into a mixed methods approach to see how the clinicians find it as well. So yeah, this scientific angle has been there for uMore from the very start.
Yeah, that's super solid all around. I love your app, love what you guys are doing. At RPH Ally, obviously we're a social media platform for pharmacy professionals, and as I'm sure you're aware, in healthcare, there's a lot of burnout, whether you're a pharmacist or a physician or a nurse or another healthcare professional, a lot of them are struggling maintaining their mental health, leading to things like burnout, depression, and anxiety. How can, a pharmacist or their healthcare professional kind of improve their well-being by using this app? I mean, is this a tool that they can use to, improve their overall emotional state?
Yeah, absolutely.
Decrease the burnout, type of stuff that we're seeing all over the place.
Yeah, like you mentioned, it can be downloaded by anyone. So it's open on the App Store and it's available for everyone. The app isn't therapeutic; it's not an intervention, but it is a tool to help you measure and monitor how you feel over time. From the pattern recognition that can be derived from that, there might be some insights which we can apply to our lives to, help us understand how, what should I be doing on my day to day? What makes me the happiest? And maybe what should I be trying to stay away from, which is clearly affecting my moods. That's what we try to show through these correlations. So it's something which is all based around self-quantification and empowering people to become activated within their own mental health care journeys to have all of that information in place. But it's not a therapeutic in that regard.
Yeah. And I could see this as being something where pharmacists can recommend this as a tool for their patients. If they're treating, they have a patient who's on, anxiety medication, antidepressants, as a tool to help them. If I'm a pharmacist, I can tell my patients, hey, download the uMore app, and that can help in addition to your medication therapy.
Right. And that's what I'm really interested in hearing about. Like I mentioned, we've been live for about a month. It's still quite early days for us, and we have a lot to learn. Because we're a startup, we love to learn and we can move quite quickly. And I know that there is a need within the pharmacy world, especially when it comes to being able to measure and monitor the impact of the administration of like pharmacological drugs, and how we can use like these evidence-based measures to understand their impact. So we'd love to hear from you, Eric. Where do you think the potential is here within the field?
Yeah, when I was first, hearing you talk about the app, when I was thinking of, the dashboard, I was thinking, of course, your psychologist, your psychiatrist, more of the prescriber setting. I wasn't so much thinking about it, can a pharmacy actually adopt this software as well and use it to help their patients? So maybe I'm going to bounce that question back to you. I mean, is this something that a retail pharmacy can use to provide better services and outcomes to their patients?
Yeah, two things come to mind, which is firstly, it has a medication tracker implementable within the app. So you can very easily, as a user, this is as a patient, be able to track your medication within that, and then start to have this educational component to see, how this is correlating perhaps to some of my moods, the days where I did take it versus the days that I didn't. So I think there's an inherent value for the patients who attend these pharmacies to have this as a value add and want to return to these pharmacies because of the value that the app can give. From a pharmacy perspective, I also think that maybe some research and learnings from that data may be potentially of interest as well. So I think those are a couple of ideas that come to mind. I did mention also the dashboard, which I showed quite briefly. And there is the option for pharmacists to be able to monitor patients remotely. So to be able to get up to date, like how have they been taking their medications and, what impact has this been having on their mental well-being from the surveys that are coming through. So that's also something which pharmacists would be able to use. You gave the example, Eric, of like, for example, notifications, if there has been a consistent downturn, perhaps in their mood or let's say their stress or their depression. So I think those tools might also be of interest as well.
Yeah. And I could see it being helpful, even if they do not log that they took their medication, could be a sign that they aren't taking their medication. So it can prompt a phone call from the pharmacist just to check in and say, hey, you haven't recorded taking your medication for the past few days. Are you taking it? Is there anything going on? Just to make sure that they are staying compliant with their medication regimen. The last question I have is it possible to have a patient using this with their providers, but to be having the patient's physician and the patient's pharmacist have the same dashboard, so it allows the pharmacist and the physician to collaborate a little bit better on the patient's treatment?
Right. Yeah, it's a really good question. We actually set up a feature which enables multiple people to view the same patients. So yes, we have the functionality so that whether it be, for example, a nurse and a psychiatrist within a clinic, or a psychotherapist and a social worker within a practice, or pharmacist and collaborating doctor, within another organization, they're able to come in and monitor that. Of course, as long as there is consent from all parties involved, including the patient.
Yeah, of course. Alejandro, this has been fantastic. We're about at time here, so we're going to have to wrap this up. But I'm sure a lot of our viewers are very interested in your guys' product in one way or another. how can they get more information, get in contact with somebody if they're interested in finding out more information?
Yeah, absolutely. So they can email me at alex@umore.app. That is uMore spelled like it is on screen and app spelled APP. I know it's confusing because my name is Alejandro and my email is Alex. I go by both names, but the email is super simple, alex@umore.app. And they can also check out the uMore website, umore.app. And from there, we have a little link where they can book demos if they want to see the technology up close. They can also ask for particular feature requests that, maybe there's a certain challenge that they have in their pharmacy that they want us to help them explore. Like I said, the technology stack is very flexible and easily deployable quite quickly. So you can get in touch with me either way that way.
Cool. Alejandro, it's been a pleasure having you on. Thank you again. Thank you so much for joining us. And more importantly, thank you for developing this wonderful technology that is helping so many people. And it sounds like it's just going to continue to get better and better and help many more people to come. So thank you and the other co-founders at uMore for developing such an awesome product.
Oh, thank you so much. Thanks for giving us a little bit of visibility today to talk about it. I really appreciate it. And yeah, you've been a great listener, Eric.
All right. Our pleasure.